Hey everyone, welcome back. Today we're going to be talking about pain terminology. If we start to take a look at some of the basic requirements that the APTA and the different spinal groups are suggesting as part of curriculum, one of the things they really recommend is a discussion on pain terminology. And the reason that we want to discuss pain terminology because it gives us a common language to talk to other professions about what's going on and what we think's going on, and it really gives us information about what we think the physiological mechanisms that are going on that are occurring in somebody. And now we've held off a little bit with these terminologies until we had a little bit more background about some of the causes and sources of someone's pain. But right now it seems to be an appropriate time to go ahead and start talking about pain terminology. So we're going to kind of go fairly quickly through this because I know it could be kind of arduous to talk about pain definitions. But you'll see what we're going to be talking about these different pathologies. So there's 3, 6, 9, 27 different pathologies or so that we're going to be talking about. And I'm just going to give you the definitions. So feel free to go ahead and double time on this or speed through it or just read it on your own. But I'm just giving words to the definitions that are on the paper. So we're going to have a discussion on the terminology, and it seems like the most appropriate place to start is with actually the definition of pain. We've talked about the definition of pain in prior lectures somewhat, but this just puts it to a more definitive definition. So if we're starting to take a look at it, we really see that there is an older definition of pain, and that was defined as an unpleasant sensory or emotional experience associated with actual or potential tissue damage, or described in such terms of damage. But if we start to take up the newer definition, it's somewhat same, but there's a few key elements that are a little different. It's an unpleasant sensory or emotional experience associated with or resembling that association with actual or potential tissue damage. And this is where it differs. It's the second half of that. It's actually resembling that associated with or actual potential tissue damage. And so through our lectures together, I think that kind of makes a little bit more sense how it can be actual, but also indication of potential tissue damage. 6 keynotes and etymology. Pain is always a personal experience that is influenced to a varying degree by biology, psychology, and social factors. Pain and nociceptions are different phenomena. Pain cannot be inferred solely from activity in sensory neurons. Throughout their life experience, individuals learn the concept of pain, so pain is a learned response. And a person's report of an experience of pain should always be respected. Although pain usually serves an adaptive role, it has many adverse effects on function and social and psychological well-being. As well as clinicians, we are very aware of that. And the verbal description is only one of several behaviors associated with pain. Oftentimes we associate pain with someone telling us we have pain, which is the verbal description. But sometimes even if people have inability to communicate, it does not mean that they don't have pain. It just means that they're not able to express it as pain. So what are some different terminologies for pain that we're going to talk about? Allodynia is really pain due to a stimulus that does not normally provoke pain. So pain to a stimulus that does not normally provoke pain. So say it's light touch. So when a patient, if you touch them lightly and they start to have pain, that's allodynia. Analgesia is actually the absence of pain in response to a stimulus that would normally be painful. So anyone who goes to the dentist and gets a shot, they know that typically if a dentist goes in and starts doing their work, that may be painful. The shot numbs it. It's called analgesia. Anesthesia dolorosa is pain in an area or region which is typically anesthetic. So it's an area that typically does not have pain and it starts to have pain. That's called anesthesia dolorosa. Causalgia is a syndrome. It's kind of this burning allodenic type pain or hyperpathia. And usually the key is it occurs after a traumatic nerve lesion. And it can often cause vasomotor or pseudomotor dysfunction and may cause trophic changes. So the new term for this is actually complex regional pain syndrome. It's gone through a couple morphosis of terminology. Causalgia was renamed reflex sympathetic dystrophy. That was renamed complex regional pain syndrome. Basically, the hallmark sign of causalgia is this burning pain that occurs with injuries to the nerve and may cause these changes in skin and vascularity. Dysesthesia is an unpleasant abnormal sensation, whether spontaneous or evoked. So oftentimes we focus on the pain aspect of things. This is any abnormal sensation, not necessarily pain, but any unpleasant abnormal sensation. Hyperalgesia is increased pain from a stimulus that is normally provokes pain. So if something is painful, say you stick yourself with a pin, that would be painful. Hyperalgesia is when the pain is amplified over what's normally felt. Hyperesthesia is increased sensitivity to a stimulation, which excluding the special senses. So it doesn't include things like vision and things like that. If you have light touch, there's an increased sensitivity to stimulation. So it doesn't have to be pain. It could be any type of sensation. Hyperpathia is a painful syndrome characterized by abnormal painful reactions to a stimulus, especially a repetitive stimulus, as well as an increased threshold. So what you'll see is what happens if you repetitively stimulate someone, there'll be an abnormal pain reaction to a stimulus, similar to what we were talking about, wind up, or there's an increased amount of sensation, but also an increase or a decrease in the amount of pressure that's required, potentially to elicit a painful stimulus. Hypoalgesia is a diminished pain in response to a normally painful stimulus. So we talked about hyperalgesia and hypoalgesia. Hyperalgesia is when you have less pain to a painful stimulus. So if you stick yourself with that pin, now it doesn't hurt quite as much. That's hypoalgesia. Hypoesthesia is a decreased sensitivity to stimulation. So what happens is if you rub your hand over and over again, eventually you don't feel as much pressure or as much sensation. That is called hypoesthesia. Neuralgia is pain in the distribution of a nerve. So if you have pain, it's right along the course of those nerves. Neuritis is taking those nerves, and the cause of it, that nerve irritation, is actually inflammation. Itis, inflammation. So it's inflammation of the nerves. Neuropathic pain is pain caused by a lesion or a disease of the somatosensory nervous system. So neuropathic pain would be something like a radicular pain, that's where you get the pinching of the nerve in the cervical spine because of a disc or facet. That would be an example of neuropathic pain. It's pain caused by a lesion or disease to the somatosensory nervous system. Neuropathy is a disturbance of the function of a nerve. So it could be things like decreased sensation or increased sensation. People have diabetic neuropathies when they don't feel as much in their feet. That's a disruption of the nerve. Someone can have hyperesthesia in their feet, which means there's increased sensation in their feet. That could be an example of neuropathy as well. If it occurs in one nerve, it's a mononeuropathy. If it occurs in several nerves, it's a polyneuropathy. It could be diffuse, it could be bilateral. There's a number of different variations. Nociception, we talked about that quite a bit in this class already. It's a neural process of encoding noxious stimulus. So remember, it's an indication of tissue damage that's occurring as a result of noxious stimulus or tissue damage. Nociceptive pain is pain that arrives from the nociceptor. So it's actually an indicator of tissue damage. So pain that arises from actual or threatened damage to a non-neural tissue. And it's due to the activation of nociceptors. So there's actually damage to the nerves that we've talked about, and there's damage to tissue. Nociceptive pain is damage that occurs at tissue level. Neuropathies, neuropathic pain is pain that originates in the nerves themselves. Nociplastic pain is pain that arises from altered nociception. So this is a newer term that was just placed in recently. So it's pain that arises from altered nociception despite no clear evidence of actual or threatened tissue damage, causing the activation of the peripheral nociceptors or evidence for disease or pathology of the somatosensory system causing the pain. So this is a long way of saying it's those mechanisms that we talked about with sensitization. Nocioplastic pain are some of those changes that occur because of the sensitization process that we've described in other lectures. Paresthesia is an abnormal sensation, and this could be whether it's spontaneous or evoked. So it's any type of abnormal sensation that occurs. Central sensitization. Remember, we've talked about in these prior lectures, it's an increased responsiveness of the nociceptive neurons in the central nervous system to their normal or subthreshold AFR input. So what happens is it takes less and less pressure or less and less stimulation to activate the nociceptive network. And this is defining those changes that occur in the central nervous system. And peripheral sensitization is those changes that occur in the periphery. Pain threshold is that point when somebody has pain when you apply a painful stimulus. So what do I mean by that? It's the minimum amount of pressure you can place on that, or the minimum intensity of a stimulus that is perceived as painful. So if I took a pin and I start to put down onto your skin, when you start to say, ow, that hurts, that's the threshold. Or if I took pressure and put it down onto your structure and kept putting pressure, and when you say, oh, that's when it starts to hurt, that's your pain threshold. And that's different than pain tolerance. Pain tolerance is how much you can actually take. So say I take that, put pressure onto your tissue again, and you say, oh, that hurts. That first one is the threshold. I go, keep going, tell me when you can't take anymore. You go, that's where it hurts, I can't take anymore. That's your pain tolerance. So it's the maximum intensity of pain producing stimulus that a subject's willing to accept in a given situation. And that's the end of that module. So those are the definitions that we were discussing today. And just to give you a little background or give you a little different kind of a common language in which you can start to discuss these different pain-related issues that go on in the human body. So that's it for today. Thanks for joining, and we'll see you next time.